Let me start by introducing myself. I am Dr. Zukiswa Nzo. I am the second deputy chair of the C20 under South Africa's G20 presidency. I'm also a research fellow at the Center for Human Rights at the Faculty of Law at the University of Free State, and I also serve in various governance roles. My work has consistently focused on inclusion, human rights, and disability responsive development and innovation. And I am really honored to welcome you to this Working Group 12 on Science, Research, and Innovation Investment. It is my pleasure to welcome you to this working group. And I just want to highlight that South Africa's G20 presidency sees science and innovation not just as engines of competitiveness, but as pathways to justice, inclusion, and sustainability. So C20 in this working group has ensured that civil society is involved in shaping global science and innovation policies so that they are open, equitable, and socially responsible. Within the C20, in this year's G20 presidency, we carry forward the work of India and not reinvent the wheel, which emphasize digital public goods, open science, and building research ecosystems. And in Brazil advanced the G20 bioeconomy initiative rooted in equity and sustainability. So our responsibility this year is to build on these foundations, as we have been doing through various engagement sessions in this working group, ensuring Africa's scientific leadership is recognized and resourced. And the work is grounded on various instruments, such as the Sustainable Development Goal 9 on industry, innovation, and infrastructure, as well as the United Nations Educational, Scientific, and Cultural Organization recommendation on science and scientific researchers, which establish global norms for inclusive, but not only inclusive, but also ethical science. That is on the global level. But on the continental level, the Science, Technology, and Innovation Strategy for Africa and the African Union Digital Transformation Strategy for Africa 2020 to 2030. This digital transformation strategy charts a vision for inclusive and innovation-driven design. And then when we come home nationally, South Africa's white paper on science, technology, and innovation and its bioeconomy policy frameworks, these commit us to inclusive and transformative science systems. So colleagues, today we will hear more in depth about this working group from Mr. John Ndluli, as well as Dr. Ndumiso Chuma, who will share insights on financing open science and responsible innovation, etc. And then after their inputs, we will then open the floor for questions and engagements. Colleagues, innovation without equity is hollow. The C20 has deliberated, as indicated earlier, and remembered that our advocacy is not only for G20 leaders, but also for communities across Africa and the Global South who look to these processes for tangible outcomes. Again, tangible outcomes. So with that, I warmly welcome you to this working group and look forward to a robust dialogue. Thank you so much, Mr. John Ndluli and Dr. Ndumiso Chuma. I hand over to you.
Thank you very much, Dr. Zuki. It's a pleasure and privilege for me and Dr. Chuma to be presenting to you today or providing an update on the policy brief for the science, research and innovation. But before I start, maybe let me hand over to Dr. Chuma just to do a quick opening for us, and then I will then take you through our presentation. Over to you, Dr. Chuma.
Thanks a lot. Thanks a lot, Abu Mdluli and Dr. Zuki for this grand opportunity to come through and make a presentation. I must say that it has been a long road to get to this point where we have got this particular presentation. There has been extensive consultations and with various stakeholders. Some of the colleagues have been participated in some of the WhatsApp groups in relationship to this particular working group. And at this particular moment, I would like to welcome my facilitator to come through and make the presentation. Thanks a lot, and over to you. Over.
Thank you very much, Dr. Chuma, for that short and sweet introduction. As you have rightfully said, we might be the ones providing an update today, but honestly, this has gone through a quite extensive consultation, and we're talking on behalf of the working group. Dr. Zuki, before I proceed, please confirm if you can see my slides.
Yes, Mr. Mdluli, we can see it.
Thank you. We were actually planning to present on Friday, but unfortunately we couldn't. And like Dr. Chuma has said, this is the great opportunity for us to really provide an update on what we have been doing under science research and innovation. So as you might all be aware that this working group really is coordinated by 3 organizations, which is SATAC, Best Health, and GHTC. So SATAC really is a South African-based coalition looking at strengthening Africa's health technological advocacy in South Africa and across the region. And SATAC was very fortunate to be afforded the responsibility of facilitating this working group. However, SATAC is not working alone. We're working with our partner organization called Best Health, represented by Dr. Ndumiso Chuma, who's currently on call with us. And I must also say that Best Health Solution is a professional health entity specializing in both industrial and corporate, as well as domestic health improvement programs, including research services and training. So Best Health really, uh, in terms of its representation, they are more at the national level or at a country level. But then part of the structure really of the working group was that we needed to have an international organization or the global representation. And in this instance, we've got the Global Health Technologies Coalition, which is a US-based coalition working on improving the lives globally, and they conduct research and development of vaccines, drugs, diagnostics, and other essential health technologies. And in short, this will be the content of our presentation. Yeah, so in terms of executive summary, really, as we might all know that South Africa is hosting the G20 presidency, and this highlights science research and innovation investment as central to sustainable development and building a resilient and global health equity. And I think in her introduction, Dr. Zuki has really touched on this. So within the Science Research and Working Group, we also look at initiatives around bioecology, which has advanced key deliverables. And honestly, we can't do all of this science if we don't have communities in mind. So we are also working very close with civil society to bring that community perspective to, as well as the South to South collaboration. And we have seen quite a lot of challenges when it comes to global research and development investment. However, one of the biggest challenges is that access remains a big challenge. And what we mean by access is that all these health technologies will be developed, but when they are supposed to be disseminated to those who need them the most, then access becomes the problem. I mean, we can look as way back as during the time of ARVs. When ARVs were made available, access was a challenge. And therefore, in our executive summary, we're calling upon the G20 leaders to really commit to an inclusive governance framework that ensures targeted financing for equitable access as well as equitable outcome. Uh, and also, they need to consider strengthening regional partnership, which is embedded in participation, justice, and equity as far as the science, research, and innovation outcomes are concerned. So moving forward, we really need to look at our problem statement. So we think science research, innovation, and investment is critical really in addressing quite a number of global challenges, from your pandemic preparedness and response to your antimicrobial resistance into issues involving climate change and health, including how do we go about building a resilient health system that responds to these challenges, into equitable access to health technologies and innovation. We also believe that persistent innovation will help us to address the access gap limits regarding historically marginalized population and communities. I think we have spoken a lot about this, where your marginalized population will always come first when it comes to access to health technologies. Rural vis-a-vis urban communities. Again, rural communities, in most instances, they tend to be the marginalized ones, in the sense that when innovations are coming, they are not getting the same priority as their counterpart or the urban communities. They are always last in the queue. So we are then saying we need to bear this in mind. Well, another challenge which was historically prominent is how men and women were treated when it comes to different opportunities. Despite all the transitions that we have gone through, for sure, we still know that women are at the disadvantage side, and there's quite a lot of data to support that. Another group is people living with disabilities, including countries of the South. So, yeah, this we as a science research and innovation working group, we recognize these limitations, and we are saying for us to be successful, we will need to address these limitations. Well, as far as my introduction is concerned, I think a lot has been said about the G20 presidency, but as a science research and innovation, we would like to place this working group at the core of its agenda. And so far, I think there's been a lot of engagement under this working group, with the first launch happening in February in University of Free State. We had a follow-up meeting in May, and we were also privileged to be participating in the Civil Society Forum launch, which happened in June. And very recently, there was another third science research and innovation meeting that happened at the in Pretoria. And really, we are looking at these as platform to lay foundation for the G20 Research and Innovation Ministerial Declaration, including different engagements. Because one of the things that we did with the third meeting was to compile an ask document or call to action, which we are hoping we will be submitting it with our policy document that will be going to our local government. And then we also recognize that civil society engagement is very key. I've spoken about the launch that we are all aware that happened in June. And honestly, if what we are saying under civil society is that we need to push for transparency, we need to push for equity, we need to make sure that the voices of the communities are heard. And most importantly, the South collaboration. It's very important that the voices of the previously marginalized groups are taken into account. There's quite a lot of uh, policy positions that are really guiding the work that we are doing. One of them is your African Union STARSA 2024 guidelines. We are also looking at the World Health Organization local production and tech transfer agenda. We also looking at the G20 declaration on health research and innovation. And looking at the role of science, what we are saying science is very key for your sustainable development goals. Zuki spoke about sustainable development goal number 9, but I know for sure that health science and innovation is mostly emphasized in goal number 3. And we believe really that through all of these guidelines, we can build a resilient and responsive healthcare system. And we have spoken a lot about the inequality and lack of access. I think that remains a big challenge that we need to address if we are to be successful into our campaign. And we therefore calling upon the G20 leadership to provide us with opportunities that will ensure equitable benefits for all, especially the marginalized communities. And in compiling this policy brief, there were a couple of issues that we needed to take into account, and we have undergone a process of issue analysis where we have really looked at the innovation capacity and infrastructural gap. And really, in analyzing that, we have realized that we need to institutionalize community-based participatory research that will really help us to build locally relevant innovative ecosystem, especially in rural areas in the agricultural technology sector and in rural health. We have touched on the issue of gender disparities, especially looking at the marginalized group like women. And we are saying, although there has been a lot of progress in terms of attaining gender equity, uh, however, the biggest challenge is that we are not yet at 50-50. Tech transfer is one of the issues that we need to look at, and by so doing, we want to close the innovative gap that we have identified, especially in financing and technology, including open source model. We would like to prioritize the disability by making sure that everybody is considered when these health technologies are being developed. One of the things that we have spoken about in the current status was that we need to strengthen our regional innovative ecosystem, especially in the global south, by looking at the investment and innovative financing. I think we are all aware of the impact that the USG government with funds withdrawal had on our programs, especially in the countries of the South. And what we are saying is maybe we need to start thinking outside the box and look at how we can come up with innovative funding models. And one of the things really is how do we reform our government, including civil society engagement? Um, One of the biggest barriers really that was identified was your regulatory harmonization, including ethical framework for digital as well as artificial intelligence driven innovation. We still feel that there's quite a lot of work that still need to be done around this area, and this is one of the things that we will be looking at. We also want to expand the civil society participation in this working group for to ensure there is accountable and community-driven priorities. However, we also recognize that there are threats to everything that we are proposing. Uh, Aspects such as your antimicrobial resistant, frequent climate change, including digital ethics across the science research and investment remains a challenge. We want to ensure that there is an inclusive, forward-looking agenda to address all of these emerging global threats in health, environment, as well as our technological challenges. Um, on that note, I think this is really our last slide where we want to talk about the recommendation. Yeah, our first recommendation is that we would like to institutionalize our community-based participatory response by making sure that community-based uh, participatory research becomes central to G20, as well as the science research and innovation agenda. We would like to close the innovation and access gap that we have spoken about, especially when it comes to publications, equitable financing, including tech transfer and the fair distribution of resources. And we would like to strengthen our regional ecosystem by investing in research infrastructure, building capacity and networks in the global south. And then we want to advance regulatory harmonization by aligning both regional as well as international framework for safe, timely, and equitable access to technology. And finally, we would like to mainstream inclusion that ensures that everybody is catered for as we attain all these science research and innovation products. On that note, we would like to thank you and maybe hand over to our facilitators to guide us on our next steps.
Thank you so much, Mr. Mdluli. Yes, for that background, I see there's a round of applause from quite a number of the participants here. As indicated, Mr. Mdluli, if Dr. Chuma is not going to present, I would like for us to take some questions from the floor. But allow for some engagement. So I'll look out for the hands. Sis Ayanda, could you kindly help me as well? Indeed, it shows that you guys have gone through quite a journey and you've substantiated that by, giving us a somewhat your methodology that you used in getting this far. Hopefully, I know a lot of work has been done, but I hope that in these engagements as well, there might be input that might also help you refine the work that has been done so far. So, colleagues, I open up to you. If you have any comments, any additions, any points of clarity, or any burning issues that you would like to raise, please, this is your moment. Perhaps while we wait to see if there aren't, okay, I see a hand. Miss Comrade Nombasa.
Thank you so much, Dr. Nzo. Am I audible?
Yes, ma'am, you're audible.
Yes, thank you so much Mine is mostly a comment, not really a question. Just to congratulate the facilitator and the co-facilitators on the work that has been done. I know when we were starting the process, we were intentional to make sure that this is the opportunity for Global South, but also specifically for the African region. So one of the issues that I'm glad that I'm seeing a significantly coming out is the issue of regional manufacturing, which highlights the issues of tech transfers, infrastructure, and I think the glaring issue of the financing for R&D. Because we said that this is the we leveraging on work that has started in Brazil, because the issues and the challenges that Brazil's
Yeah.
have as the one of the countries from the global south are similar to what we're having. So this was also the opportunity for us then to push for the global south, whilst we are also pushing for the Africa region. And bearing in mind that at this moment, we are not sure of when this opportunity will be coming back to the global south or to the Africa region again. And I'm hoping then is because I'm seeing synergies then that are coming out from here that we are also pushing in the equitable health for all working group, and also in the working group for women gender inequality when it comes especially to health R&D and then the accessibility. So yeah, I just then wanted to congratulate the team that was facilitating, but also those that were engaging in input to the policy brief that we're talking about today. And thank you so much, and back to you.
Thank you so much, Comrade Nombasa. Yes, indeed, we don't want to reinvent the wheel. Hence, we look within the Troika, what has been done, what are the similarities, and then build on that. And yeah, of course, the participants that have been engaging in all these consultations, really big ups to them for sharing their input that has led to this. Can I just get a reaction from Mr. Mdluli or or Dr. Chuma on those points that have been raised? And I think one other thing that was highlighted by Comrade Nombasa is the synergies within her working group, which is equitable health, as well as this one too. So it shows that one is not in a vacuum. There are some overlaps and some things that we can draw from each other. Mr. Mdluli and Dr. Chuma?
Okay. Dr. Chuma, do you want to jump in first?
Yeah, I think for me, I like what Comrade Numbers spoke to around the aspects of synergies, and I think it further emphasizes the need to act and not to look at it as a once-off initiative, but something that is more of an advocacy issue that needs to be carried forward post C20 G20 period. And also the forms of collaborations and alignments that have been formed during this particular period, not only to look at it from the Science, Research and Innovation Working Group, but cross working group collaboration. It's something that needs to be carried forward post this particular season. And thanks a lot for the positive feedback. Thank you. And over.
Thank you very much, Dr. Taylor. Maybe to comment, I would like to comment about two things. I'm not going to comment about synergies. I think Comrade Nombasa has clearly outlined that, and Comrade Ndumiso also added on that. But where I really want to comment, I would like to comment on issues around local manufacturing and be practical, comrades. I remember before we take over presidency, we had a meeting in Ekurhuleni where we were talking about product development. And in that meeting, it emerged that there was a new product called lenacapavir, which has shown some level of efficacy. And when the result, post the results of lenacapavir, the licensure was not given to South Africa, despite South Africa contributing into the science of lenacapavir. However, through aggressive civil society engagement, we are seeing a situation where South Africa is now considered to be able to locally manufacture this product, and even calling for more research to see if lenacapavir can be used as a therapeutic option. So having said so, I think, Comrade Nombasa, you're quite correct to say local manufacturing and building the local capacity, it does contribute to the socio-economic factors of the country, and it also contribute towards our GDP. And if there's anything that we need to take out of this G20 presidency, is to make sure that the countries of the South really benefit out of this opportunity. However, having said so, I know we currently, what we're talking about social summit and handing over the presidency. But I think Dr. Chuma has said something very interesting to say, how do we now sustain whatever that will have built since we started with the C20 activities, and make sure that we continue forever and ever, because chances are this opportunity might only come after 20 years. However, I think a very strong infrastructure has been established. We now need to start thinking about how do we sustain it moving forward. Thanks.
Thank you so much, Comrade Mhluli. I just wonder, Mr. Mhluli, and maybe Comrade Nombasa, we emphasize the Global South, and rightfully so, what should benefit the Global South. And we are to submit our declarations highlighting what should benefit the Global South. Given that G20 includes the 19 countries in European Union, how do we become convincing, for the adoption of the declaration, while we continuously highlight? I'm just throwing in a spanner there. Of course, we are all for advancing the Global South.
Do you want to take it, Comrade Sizwe, or should I jump?
I can attempt to do that, Comrade John, because what I know is that as much as now you are giving a high level kind of points that we want to emphasize and are part of our asks, but I know that in the actual policy briefs, being it ours, which is the health one, or even this one, there's also a sort of contextualization of what we're asking for. If I can give an example of the recent past, in the COVID-19 era, it was like seen that there was significant inequalities in terms of accessing the vaccines, for an example, and even any other resources that were needed to curb COVID-19. So I think that's where we're coming from, firstly. The second point is that most of the research that is out there is mostly done in the Africa region, but when the actual products are then finalized, they are taken somewhere else where we have to then go and buy them with negotiate the
Triple,
pricing.
yeah.
Yeah, because it's not in our price. So we have to negotiate affordability for it to come back, especially for public access or to these products or services. So I'm just highlighting those as basis of why this is needed. It's not even for only the Africa region, but even other regions within
Mm.
the globe that needs to make sure that we sort of potentially support the local manufacturing, because as I said also on our working group, the principle that we're going along as we are doing this work is the principle of the triple A's, making sure that there's availability of
Mhm.
services, there's accessibility, but also affordability, so that when people go out to access any service, there's no financial hardship. So I would leave it at that. Thank you.
Thank you so much, Comrade Nombasa. I just threw that in case somebody is wondering. Mr. Mhluli, do you have anything to add to that, or can we move to the next question? Do you feel that Comrade Nombasa has covered you?
You said it very well, Comrade Nombasa, but another point that I wanted to raise is we need to be careful. Out of 20 countries that are serving in G20, South Africa is the only African countries amongst
Mm,
them.
mm,
And really, and as the only country amongst them, for example, we are co-facilitating this working group with Comrade Ndomiso,
mm,
who's representing our neighboring country, which is Zim. And in attendance, I can assure you, in attendance from this webinar, we also have other colleagues from neighboring countries.
mm,
And as such, really, we really need to advocate for the global south, considering
mm,
quite a lot of issues that Comrade Nombasa have said. But in addition to that, our weak currency also put Africa at the disadvantage sides when it comes to acquiring these health technologies. So I think we've got a very strong point really to advocate for the South to South recognition and upliftment. Thanks.
Thank you so much. So as the only country in Africa, we are already disadvantaged through the other cycles, and it is our responsibility to make sure that we do benefit. But also, I think to add to that, we are globalized. So if the global South does benefit, the rest will also benefit somehow. There will be some kind of a ripple effect. Thank you so much, Mr. Mhluli and Comrade Nombasa, for that. I saw a hand from Mr. George Mapia. Please come through.
Okay. Thank you very much for the presentation, and thank you, Chair, for the opportunity. I stand here representing MSF, Doctors Without Borders, and I would like to applaud the work that has been done by this
Mm,
group on science and innovation. And also, as one of the members who has been attending, or a member together with Ms. Nombasa in the Youth Working Group, the points raised resonate well with what is being brought in the Youth Working Group. And I would say it is never enough to say we limit to a certain group, but when it comes
mm,
from all corners, I think it sends the message through. Some of the people who will be reading these police briefs might not be in health itself, but these are sectors that are contributing to the health. I would like also to add that, yes, it is surprising that until now, I think we have 9 countries that have been signed in to have reached the WHO maturity level 3, which means
mm,
they've been certified to manufacture vaccines, therapeutics, and diagnostics, but we still stand as the last resort when it comes to distribution, of which I saw the points that were indicated as key recommendations, that they are quite important, and we have raised the same as MSF, and these are considered in the declaration that the Health Working Group is working on, and there's a review again that is coming next week, and we will continue to push for such points to be considered. Thank you.
Thank you so much for that positive comment, Mr. George Mapia. I saw another hand from Sis Ayanda, but before I do that, I just want to highlight, Mr. Mdluli, that, you know, it's interesting, and I think it's also relevant, particularly in the South African context or where there's so much diversity, that you spoke about the challenges and, oh, thank you, Sis Ayanda, she says it's a legacy hand. You know, how certain aspects affect various groups of people differently. So, and you kept on indicating in your presentation inclusion and equity and so forth. So I just want to share that within the D20, interesting enough, within the D20, the Disability 20 engagements, particularly this goes to the synergies and the overlaps again. This came out in the Agriculture and the Poverty Working Group, where we heard stories that highlight why science, research, and innovation must be inclusive by design. So the D20 focused on lived experiences, just to give a picture of what the reality of disabled people looks like. So this is what one of the participants said. She said she said this very powerfully. She said, even the spade I hold was never designed for my hands. So that statement, this comes from a lady with a disability who wants to venture into the agricultural space. As she says, so now that statement captures the essence of exclusion in technology and design. Yet, despite these barriers, persons with disabilities continue to innovate, from hydroponics to online food marketing. That's what she said later. So this shows us that when participatory research, as you've highlighted, includes those who are historically left behind, it leads to new forms of innovation that are both equitable and accessible. So it's a reminder that inclusive design and co-creation or participation in technologies are not just social priorities, but scientific and innovation imperatives that the G20 Science, Research and Innovation Working Group should actively champion, as you have been doing. So I just wanted to substantiate a number of the points that you have alluded to, and also you made mention to those that are left behind, like disabled people as well. And here is another practical example that actually came from a different engagement group in a different working group. Thank you so much, Mr. Mdluli, for that. So, colleagues, are there any more hands or any more comments? And even from your side, here's a question or a comment from Mr. Andrew Hofmeyer. I want to also highlight that the members of the D20 are also here. Mr. Andrew?
Hi, Dr. Nzo. Thank you for the opportunity. Thank you, colleagues, for the presentation. It's wonderful to be part of the conversation. I just wanted to mention that in the Disability 20 working group that focused around science, research and innovation investment, a really strong point that was discussed at length was the absolute need to make the focus on assistive technology to become a mainstream innovative part of the mainstream innovation engine, a really critical point. I think the words that was used, that sometimes assistive technology is perceived as a niche market thing, but the level of inclusion that one can establish by ensuring that whatever technologies are released and made available are inclusive by nature. For instance, websites, just as an example, can make an enormous, including people.
Mr. Andrew, we are struggling to hear you.
Additional benefit.
Mr. Hofmeyer, we're struggling to hear you. Colleagues,
I'm also
I don't know
struggling.
if I'm the
It
only
must be
one.
my connection.
But while we're not hearing Mr. Andrew, can I give Mr. Mdluli and Dr. Chuma? I'm looking at our time, and then maybe we'll try and go back to him again. Do you have any final remarks that you would like to share?
I've heard what Mr. Hofmeyer was saying, although not in detail, and I would like to applaud the C20 leadership. When I remember when the Science Research and Innovation Working Group started, there was a plan to merge the D20 and our working group. But when the two were separated, I said, thanks God, because it kind of gave the D20 group an opportunity to raise their voice and be heard. Yes, maybe innovative technology can address some of the challenges that they are experiencing, but I think the D20 as a working group, it needs to be recognized as such, and their voices and platforms needs to be created for them to really express their voice. Thank you very much.
Thank you. Thank you so much, Dr. Mdluli. Mr. Mdluli, I have just promoted you to doctor. I've just promoted you. Thank you so much for that. And you are quite right. The C20 has been very clear and very loud in supporting the D20 as its own an engagement group that can be recognized. And while you're at that, I'd like to just remind everyone that, or rather advise everyone that the D20 will have its own session similar to this on all the 14 working groups on the 9th at, Sis Ayanda, what time will that be? I think it would be at 6 o'clock on the 9th. Okay, Sis Ayanda is probably not hearing. Yes, she's given a thumbs up. So please join if you can and engage in those discussions. Can we move over to you, Dr. Chuma? Do you have any final remarks?
Yeah, I think final remarks, considering that we are left with 2 minutes, is that, you know what, let's look at this as not words on paper, but as momentum being gathered. And let's commit to motion. Thank you, and over.
All right. Thank you so much, colleagues, for your time, for taking your late afternoon to be with us today. And thank you for engaging. Thank you, Mr. Mdluli. Thank you, Dr. Chuma. And thank you, Sis Ayanda, for, ensuring that we do have this platform. With that said, colleagues, please have yourselves a very good evening.
Thank
Thank
you.
you.
Bye.
Bye.